This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. Are there any kind of common misconceptions when people think about going into CRNA school and then actually getting in? Is there, they think it's going to be one thing and then it's something totally unexpected?
Definitely. I think that's everybody's experience. Because you'll watch somebody that's extremely smooth and efficient and have been doing it for 12 years, and you're like, well, this is easy.
Yeah.
This is very simple. Look at them. They're just handling it, And one of the mentors that I had early on in my career, her favorite saying was, we're hands-on sometimes, mind-on always. Mm-hmm. And so that's really stuck with me through my career, because there are times where somebody will be like, well, how did you know that was going to happen? You need to be 3 steps ahead. So understanding surgical procedure in and out, to know where we are. Okay, in 2 more steps, we're going to release a clamp. Okay. I'm going to get a flush of CO2. Okay, I need to go ahead and start over-breathing my patient, have my bicarb ready. What was my last gas? These types of things that you're just going through this mental checklist in your head, but to everybody else, it looks like you're sitting in the chair, kind of looking off in space, like, oh, they're just relaxing, having a good time. You're like, no. These wheels, it's like
other meme.
Exactly, where the woman's looking off in the algebra equations going. It's like, that's exactly what's going on all the time. Like, they're so quiet up there. You're like, yeah.
They're thinking of all these things.
Yep, exactly.
Okay, wow, yeah. I feel like I'm sure, to nurses thinking about going into CRNA, all they see is dollar signs, and then they actually are, actually go, they're not actually thinking about all of the time and effort and, everything that actually goes into CRNA school specifically. That's what I was thinking when I'm common misconceptions, because people are, so many people are like, oh yeah, I'm going to do CRNA, not knowing at all that it's, has all of these components and it's totally life enveloping.
Yeah, I think the thing that's probably the most underestimated is the burden of responsibility and being captain of the ship in the OR from an anesthetic standpoint. One of the big revelations that we all have when we first start out in our anesthesia careers, our first time we get in the OR, the surgeon is operating. Mm-hmm. And then they look at you to keep the patient stable, and you're like, oh, this is in my lap.
Yeah.
This is my responsibility. He can't or she can't be managing the blood pressure. They're working, so that's our responsibility, and I think a lot of people, especially me, you talk about it and then you get in there and you're like, oh wow, no, this responsibility is very much something to take into account when someone's trying to decide, do I have the personality to do this? Do I want to do this and take on that responsibility?
Yeah. It's interesting, just that little example that you just made about how, just making sure vent settings and then giving a push of CO2 and watching their, anticipating bicarb and doing a gas, all of those things I didn't really, for somebody that doesn't, talk to CRNAs a whole lot. I think of CRNA as giving anesthetics and intubating and, but there's really so much. You're the one giving all of the medications, right? For the whole, procedure.
Correct.
Yeah.
So there's a reason why anesthesia schools require you to go to ICU first and have that experience, because it's such an intricate working person's knowledge that if you haven't managed, somebody in DKA before and understand, or extreme heart failure.
Yeah.
Once you get in the operating room and you're presented with those cases, it's anesthetic plus ICU management meshed together.
Yeah.
And you have to be able to put on both hats.
Right.
And understand that what I need from an anesthetic standpoint at this point in time is going to come at the cost of maybe something that I need to account for before I send them to the ICU.
Yeah.
You know, nobody likes, you know, to be dropped off or have a patient that's dropped off that is wide awake and trying to self-extubate before we've even got them hooked back up to the monitor in the ICU.
Right.
You know, so it's understanding those two roles, and you'll see a lot of some of the famous ICUs around the country will actually have anesthesiologists as the critical care attendings.
Yeah.
And there's a reason, or especially surgical ICUs. Sure. Because ICU management and surgery really go hand in hand. Yeah. So having an intricate knowledge of both makes for your continuity of care to be much more seamless.